Good afternoon, everyone. This is County Executive Pat Ryan. I know it's been a hard few months, but it's, I think, been a particularly even more difficult week. So I hope everyone is doing okay. I do want to talk a little bit more about what is happening around the country and in our community, but I first want to update you on how we're doing specifically with COVID-19. In that regard, we have good news. So that is some good news that I think we all need today. Starting with the numbers, we are at 1,737 total positive tests since the beginning back in March. But that is out of now 17,516 individuals tested. So for the first time ever, we are below 10% rate of positive tests versus those tested. So we're at 9.9%, and that is definitely a small win that we'll gladly take, and another indicator of progress towards containing COVID. We have had 77 fatalities. Of course, it doesn't get any easier each time that we have one of those, especially for their family and loved ones. So we're very sorry to continue to see that number go up, but it is slowing down at least, thank God. And we've had 1,130 individuals, residents of the county, recovered. So that is another good piece of news. You can see the trend out, having us somewhere between 1,700 and 1,900 cases 10 days out. So again, that curve really is almost flat at this point, at least in the posture that we're in right now. In terms of hospitalizations and those that are so sick that they need to be hospitalized, we currently have 11 county residents, which is in the hospital, which that number has pretty much stayed steady for the last few weeks, hovering between 9 and 11. One of them is in the ICU. And of course, in particular, we send them positive thoughts and love and wishes to recover quickly. In terms of active cases, we can continue to see a downward slope on the other side of the peak in terms of the number of active cases in Ulster County. At the peak, we were well over 1,000. We're now at 530 active cases. And again, that's the number of individuals that are positive and have not been cleared and recovered. So there are 1,130 that are recovered. Whoops, I think we're a graph behind. That's the active cases graph there. And then the final graph, and at this point, for those of you that do watch regularly, these should be familiar graphs to you where you can see the change. The final one shows two things. In blue, the blue bars show how many people each day are being tested total, and the orange line shows how many of those tests are positive. So to give you a sense, a 24-hour snapshot, in the last 24 hours, we tested 333 individuals, and only 5 came back as COVID positive. So we have seen that number now well below 10 new cases per day for quite a while, and you can starkly see the downward slope on this chart in particular. Obviously, we need to work to continue to keep things there, but that is good news also. Hospital capacity, I talked about this, 11 currently in hospital beds, and we are in very good shape in terms of surge capacity if needed, and obviously, hopefully, we don't need that. So those are the normal updates in terms of how we're doing. I'll talk a little bit more about reopening, but I think in terms of just the public health picture, if Dr. Smith were here like she was the other day, she would also share the assessment that we're in very good shape, that really each day over the last week to 2 weeks, we have seen an even greater improvement, but we're now really we're as good as we've been ever since our first cases in terms of having control over the spread of COVID, of individuals really doing the right things and following guidelines in terms of distancing and masks and hand washing. So that is all those efforts, and I know they were significant restrictions and still are on many folks. That is what has gotten us to where we are. And now it's on us, obviously, to slowly, carefully reopen while still doing our best to keep all those things in place as much as we can. Before we talk about reopening, though, I want to share what I think is some of the best news we've had since the beginning of COVID, which is about how we're doing in taking care of our seniors. About a month ago, I updated you all that we had taken a proactive position here in the county. We recognize that our senior facilities were a huge point of risk and concern given a vulnerable population and given tight density of the living quarters at many of our senior facilities, both skilled nursing facilities and assisted living, of which we have 13. So I put out a directive that at the time really no one else was doing, that we were going to test every resident, every staff member across the county proactively to make sure we knew what was happening and to really do our best to protect particularly our seniors and, of course, all of their families that are worried about them, that we know is on folks' minds. So the encouraging update to share with you all today is that we have now completed testing of all 13 facilities in Ulster County. And again, that was done by a rapid response team that we stood up over a month ago. The rapid response team not only was supporting the facilities with testing, we were also making sure they had PPE. We were making sure that all the proper procedures and protocols were put in place. And I am truly happy to and encouraged to report that we have now completed that testing, and I want to share some of those results, which overall, on balance, are very positive. At the high level, we have now tested over 1,200 residents and thousands more staff as well, but 1,233 residents to be exact, seniors who live in our 13 different facilities. We have completed that testing. The final site we're actually testing today, which is up in Saugerties. And at the high level, I'll show you the breakdown in a moment, but overall among the 13 facilities, very good news. We have one or two facilities where we have had some outbreak of COVID, but pretty much the other 11 have had essentially almost no or very minimal number of COVID cases. So on the whole, that's very good. We're obviously very focused on supporting the facilities that have had those challenges. And so I'll actually put up on the screen here the by facility data that we're releasing today to the public. Again, we of course want to be transparent about this, as we are trying to be and working to be with everything. So you can see the different facilities and nursing homes on the left. You can see the total number tested. Those are residents only. Of course, those of you that are paying close attention probably know at this point that the staff are now being tested twice per week per New York State guidelines. So these numbers are just of residents, but know that the staff are being tested even more regularly, which is obviously good. You can see in the far right-hand column the number of positive cases by facility. Some of the facilities that we've tested over the last week or so, we still have results pending. So, several facilities you can see there currently have 0, but some relatively low number of results that we're just still waiting to come back from the lab. So we'll obviously breathe a little easier when all those are back, but the initial results are very positive, even in the places where we are waiting. So, for example, the Northeast Center, 188 were tested, 0 positive, and we're still waiting on 16 results. But that's just unfortunately, the delays of getting all these processed. That doesn't necessarily mean anything bad about those 16 or any of the other pending results. And then several facilities we just tested in the last few days. Obviously, we're still waiting on those results. So once we have them all in, whether that's on Thursday or at whenever I have that, the final results, I will, of course, share that with you all. But I did want to just give everyone some positive news and confidence and hope that while we have had, of course, some challenges in some of our facilities, particularly at Tenbrook, as we know, that in the other facilities, a credit to them, the whole staff and leadership. We really have been able to keep things in check there and under control. And I do think the proactive approach on everybody's part was a key driver of that. I have no doubt that acting quickly, we definitely saved lives. Unfortunately, we did lose some, and we know that. And of course, the overall good news is not to take away from the absolute tragedy of any loss of life, particularly among our seniors. So, I just do want to recognize that, and particularly to those families that have lost loved ones, we obviously are with you and give our condolences. So those are, again, the numbers, and we will update you on the latest. In terms of, as I alluded to before, transitioning and how reopening is going, we are now exactly 1 week into our phase 1 of reopening in Ulster County and in the Mid-Hudson region. We started that on Tuesday, May 26th. Even though it feels like it's been a year, it's only been a week since May 26th. And as we sit here today on June 2nd, which, by the way, is my mom's birthday. So, Mom, if you're watching, happy birthday. Happy birthday. Happy, let's say, 40th birthday to my mom who's watching from home. I love you, Mom, and I hope you're having a good birthday. Anyhow, sorry for the distraction. We're 1 week in, and we have one more week to go, hopefully, until we can initiate phase 2. So that would put us on track for June 9th for a phase 2 start. Right now, as I just talked through, all the data in Ulster County looks very good and encouraging, which is a credit to you all. In the region, all the data generally looks similarly positive. Of course, we will continue to monitor that closely. I have a daily call with our regional control room to go over that data with county leaders and with state leadership. So we'll, of course, be making those decisions based on the data. That may mean that we have somewhat limited notice. So I would encourage and remind every business out there, if you're in phase 1 or now phase 2, which is the vast majority of our businesses fall into one of those two phases, you should be on that New York Forward website and on our Ulster County website looking at what the guidelines are, working on that business safety plan, affirming it, submitting it. I'm not going to go too in-depth on that today in the interest of time, but if you want more information on that, again, you can go to ulstercountyny.gov, go to the business section, and we have all the details there. You can call our economic development team, and they're ready to help and have been helping all the businesses through that. So even if you're not open yet as a phase 2 business, you now have 1 week to finalize your planning, get that ready, and make that affirmation so that when we hopefully hit that mark on June 9th, we are ready to go. We've seen other regions in the state now move to phase 2, some of the upstate regions, and I think Western New York is today. The capital region, I believe, will be tomorrow. So we're also carefully watching what happens there. But so far, in those regions that have been open, in some cases more than a week than us, knock on wood, we are not seeing significant spikes yet. And I think a key part of that, and I do want to emphasize, that is because we're not just going 0 to 100. We're, as I've said before, shifting into first gear, moving slowly and responsibly, and that every single resident is playing their part in wearing masks and maintaining social distance and hand washing and hand sanitizer when you are out and about and interacting. And as I've said, it's even more important now that we are following through on these things. As more people are out and moving, the risk goes up, but I think we can mitigate most of that risk. And I know Dr. Smith does as well, as she talked about last week. We can mitigate that risk if everyone follows these relatively simple steps in terms of just thinking about your daily routine. Stash a mask in your car, stash a mask around. Just remember, each of us has not only a role, but a responsibility to understand that what we each do as individuals does absolutely affect others, and especially the more vulnerable and at-risk members of our community. So I know we've been saying this for months now, and I'm sure you're at this point probably fed up with hearing me beat this drum, but I have to continue to do that in the interest of everybody's health and safety. So thank you for bearing with it and following through. And I really do think that's why Ulster County never got as bad as some of our surrounding counties, even at the worst, because you all stepped up, and we're going to have to continue to ask you to do that a little bit longer. In terms of more positive news, which we'll take again, Project Resilience continues to go well. We have shifted to the phase 2, which is predominantly about delivering groceries rather than prepared meals, and getting folks set up with other existing food support programs. We're working it on an individual basis of the several thousand households we were supporting, making sure that they're taken care of. If you are having problems with that and you haven't gotten that transition, hasn't worked for you, you can call our COVID-19 hotline and they will work you through it. It's 845-443-8888. Right at this point, we have now served 224,024, lots of 24s, meals. So almost 225,000 meals delivered. Again, thanks to the restaurants that had participated, our volunteers that are still out there delivering now groceries, and of course the generous support of so many who chipped in to help make that program work and raise over $2.5 million into our community fund. We still have enough funds in the fund to continue to deliver grocery meals, which is at a more sustainable spending rate that will carry us many more months. So that is good news. But if you do want to continue to contribute, that money is absolutely continuing to go to feed those with food insecurity, to support our existing community food banks as well that have been doing tremendous work. So I want to thank them, of course, too. As we wrap up and before we get going on with our day, I do just want to take a minute and recognize that, I think the last few months, as I said at the beginning, have been just very difficult on all of us in different ways. Whether you had a family member affected, you were affected by COVID, you've lost a job, you've been under threat of eviction, you've had to work in a frontline role where you never thought you'd have to put your life potentially in jeopardy, but you now have. So many people have so much pressure on them, and I think we all felt like it was already almost unbearable. And then in the last week, we've just seen our country begin to be increasingly divided, and to see even more tragedy, in particular to see an absolutely horrific and unacceptable and tragic murder of an innocent man for, to me, inexplicable reasons, and absolute injustice in Minneapolis that set off a wave of anger and frustration and fear that is now rippling across our whole country and absolutely having an impact here right in Ulster County and in our region, as it should. Because I, like probably many of you throughout last week and over the weekend and even last night, both Rebecca and I have just been absolutely almost without words to capture that mix of emotions and frustrations, and I know so many others feel this deeply and personally and strongly for good reason, because this is generations of injustice, systemic racism, and inequality that are once again coming up. And this is just another incident that shows that we have so much work to do. And I know that all of this emotion and frustration pent up absolutely has and the desire to affect change has spurred many in our community to want to raise their voice, to exercise one of our most fundamental constitutionally guaranteed rights to assemble peacefully and to make our voices heard, and to push for change when we know we need this change. And so that puts us in a very difficult situation in the midst of a once-in-a-century pandemic and public health crisis. But I want you all to know that I understand that desire and the need to raise our voices. I would never, and we would never, stand in the way of exercising those foundational, fundamental rights to freedom of assembly and speech. But what I will do is ask each of your help to make sure that we do that in as safe and responsible a way as we can, both in terms of maintaining a peaceful and constructive nature to our assembly, and also recognizing that in gathering, we absolutely, undoubtedly raise the public health risk for those that are participating and those in their circles. And that's just the reality, unfortunately, of the situation that we are in. I myself, in the next 48 hours, will be participating in 2 different events to exercise those same rights that many have and many will. Both one this evening down in Poughkeepsie and near the Mid-Hudson Bridge, and then one tomorrow evening in the city of Kingston. And I will be there in solidarity, but also in a face mask and respecting social distancing, and absolutely making sure that afterwards I follow through with hand washing and all those other pieces that are necessary. And I know that makes it more difficult, and but I think that the last thing that any of us wants, of course, is in raising these important issues and raising our voices, that we put more people at risk of COVID. So I understand that there's an inherent tension here, and that these are hard things that we're asking on so many levels. And I feel like all of us are just, as a friend said to me this morning, tired of being tired, both about the issue of racism and police brutality, but also just dealing with COVID and those pressures. The hope that I have and the confidence that I have is that our community here in Ulster County on Saturday, and at least one event, has already shown that we are able to do these things, both of these things, to assemble and to do so peacefully and safely, and to respect the health of those around us. So let's continue that. Please, it's on each of us, and each of us are empowered to do that. And I know that the organizers of these events have made a great effort to do so. So please, I ask everyone to respect that. And I'll just say in closing, this is another conversation that we have to continue to have and that I'm committed to having. But we have a lot of work ahead of us as we navigate through COVID to get to a place where we can honor one of the 5 priorities I outlined from day one, which is justice for every single resident of our county. And I know that we are not there, and that in particular communities of color have had this double whammy now of COVID impacting them even more greatly, and then to see these horrific events in the midst of that. And know that myself and my whole team are committed to addressing these issues. There are some short-term things we'll do. There are some long-term things we need to do, both locally and at the state level and federally. And I want to hear your ideas and have your support and participation in that. So I'm confident that we will continue to lead on this issue in the county, and that's because of you all. So thank you for that. Thank you also to all those that we regularly thank, that we will continue to thank, all those putting themselves at risk, from our first responders to our healthcare workers, grocery store staff, delivery workers, mail carriers, journalists. I want to especially thank all of the county workforce, the Ulster County workforce. So many of you are putting yourselves and by extension your family at risk to do your job, so thank you. I also want to thank Radio Kingston. I want to thank Manuel for helping us bring our message to those who speak Spanish natively, and of course to Diane and Roxanne for helping us bring our message to those who are not able to hear my words as spoken. So thank you to each of you, whether you fall into one of those people on that list or not. Everybody's got a role to play here, and you've been playing it, and we appreciate it. So hang in there. I'll probably see some of you in the next 48 hours. If I don't, I will see you in 48 hours, Thursday at 2 p.m. For our next update. Please, please, let's continue to have this be a constructive, safe, and peaceful 48 hours in our county as we navigate this crisis, and just lean into each other and looking out for each other. Thank you, and we'll see you Thursday.